Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. Now, this program is brought to you by A-Star Communications Limited, and we are your hosts. My name is Timmy.
And I am Chris-Ogbodo. Hi, happy new month.
Happy new month, yes. It's more like the month had this interval, like last month was way far, and now we're in another month.
We're already in the new. It's already a continuation, and it's a great day.
And August is here. It's here upon us. Happy new month to our listeners also.
Last week, we discussed the topic, My Health Insurance Story, during which a subscriber shared his experience about how having a health insurance plan has positively impacted his health and that of his family. We hoped you learned one or two lessons, and I did.
Yes, I also did. It was
an eye-opener for me last week.
For a lot of people who didn't take into cognizance the fact that, health insurance, people are taking advantage of it, or having health insurance has this benefit. We learned one or two things on why you should come on board and take advantage of what is being offered.
Particularly on the elderly.
Yes, on the elderly. And we're leveraging on from what the conversation and the response we got from people. We are listening people. We are listening presenters, and of course the sponsors from A-Star are also listening people. Okay. And so because we had conversation and a lot of requests were coming in about the elderly, what packages do you have for the elderly? We said, how about we have that discussion?
And so it's on a popular demand that we're doing this.
Yes,
today.
Certainly on a very popular demand. So on today's show, we shall be discussing, like we let the cat out of the bag already, care for the elderly. A very important discussion that focuses on the health needs of the elderly in our society. My dad is 83, or he will be 83 this year. So I would want to know the packages that are available for him when it comes to health issues, because we know a lot of our elders have issues as they grow older.
Loads of them. I didn't have that privilege that you did, but I knew that when my dad was 75 before he left, it was a little bit of that challenge.
Yes, they do have it. So that's why we're having this conversation today. So if you have an elderly, you have your mom, your dad, your aunt who is in the elderly category. Now, today's conversation is for you. You want to sit around and listen to our topic of discussion. And talking about our experts.
Yes, talking about our expert. Our expert is one lady that both of us had something in common. Dayo was talking about, we were expecting an elderly person.
Yes.
And here she comes. She is Dr. Abiola Adegbola, Senior Registrar, Department of Family Medicine, Lagos University Teaching Hospital, LUTH, here in Lagos. Welcome.
Thank you for having me.
Yes, so glad you are here in the studio. And, well, it is very surprising that you are here, but I'm sure you have your wealth of knowledge, and that is why you're here to talk to our listeners this evening. So let's jump right into the conversation, Regina.
Yes,
we would want you to give us, like a layman, someone who is newly listening and who doesn't understand. Okay, we all know, but still let us know, who is an elderly?
Okay, thank you very much. So an elderly person is an individual that is 60 years and above. Okay. And then we have different school of thoughts. The World Health Organization says 65 years and above. The United Nations says 60 years and above. So it's just safe to say from 60 years and above, an individual is elderly.
60 years.
Yes.
So we're not talking about, we get to hear people once they're 50 years old. You hear them, welcome to the Elders Club. So that tells you that 50, no, if you're listening, you're not yet an elder.
No, I wouldn't even subscribe to that. A 50-year-old is elderly, no.
So I'm feeling young already.
No, a 50-year-old is they are still in the middle age class.
Okay.
Not in the, elderly category.
Much better. Thank you for clarifying that.
It is a relief for some of us that are in the 50s.
No, I'm not 50, but I'm relieved for your behalf. All right, moving forward. Are there data that tells us the estimated number of elderly people in Nigeria? Do we have data backing that up? Like we have this number of people who are in the elderly category?
Yes. So in Nigeria, the last data in Nigeria was the census that was done in 2006. They found out that at that time the population of the elderly were about like 2.7% of the population, and which amounted to 4.5 million of the population as at that time. But current data that was gathered by the WHO and the United Nations, in 2023 said that we have about 3.1%. That's about 5.1 million elderly population, and this population is growing because now we have aging population. There's now there's going to be an increase in the number of the elderly. By 2050, globally, we will have about 2 billion, elderly people around. So it's a good topic.
Well, that tells us that Nigeria should begin to brace up. We can't assume that we say it's just a 3% of that, talking about 280, they say, million Nigerians. But even if it looks like it's 3 million people that are elderly, that's a good number for us to begin to talk about that.
Yes.
I agree with you, absolutely. So let me ask you, would you say that the healthcare system in Nigeria supports the care of or for the elderly?
Yeah, I will say yes. And then I'll say yes because I work in LUTH, and we see about 50% of our patients are the elderly ones that we see. They come in, well, probably because they have their health insurance with us, and they come in, for consultation. So we have quite a number of them coming in, yes. However, Nigeria is not there yet because we don't have, in the developed world, there are like geriatric centers where the centers are majorly for the elderly people.
So what you mean by geriatrics, meaning maybe gerontology?
Yes, geriatric is just simply the study of the elderly ones.
Okay. I needed
There
to
is
know
a
that.
study for them.
Yes,
Okay.
We have experts. They call them geriatricians.
Okay.
They are also doctors, but they've specialized, to only, look after
The elderly.
Yes, the elderly people.
Okay, well said, well said. I'm going to go further and ask, why is it important to talk about the care of the elderly?
Yes, it's important, it's at both ends, for the physician, for the caregivers, the family and the friends. It's important to talk about the elderly. Once a child is born, aging starts. The aging process starts once an individual is born. So it's important that we are aware of the problems the elderly persons have. And for us as physicians, it's not just you're seeing the patient, the history, the examinations. There ought to be comprehensive geriatric assessment, a total overhauling. When we are seeing them, we're supposed not just to focus on their medical conditions, but focus on their cognitive functions, their activities of daily living. We should focus on their support, social support, because we see some of our elderly, when they come in, we ask them, 80-year-old man is living alone. That's a deficit somewhere that needs to be addressed. Then for the caregivers too, they need to to be aware that these people, they have some health challenges. They are not the same people they've known before. There's a lot of personality changes, a lot of dependence on them. So they should be able to, accommodate them, support them, because they are the only families they have. So they need as much support as they would, want to have
I'm
at
going
that
to
level.
ask you this because you just said something that pricked something within me.
Okay.
Talking about 80-year-old being alone, does that tell that there is a shift from our culture and tradition? Because it's not a common thing to find old people living alone in Africa, much more Nigeria. So from what your interactions over the years now, I can tell your experience, are we beginning to think that elderly people are being left and there is a need to be cared for?
Yes, they are being left. Well, I've seen like so many of them. They come in and you're asking them, "Do you stay? Are you staying alone?" And they tell you, "Doctor, I'm alone." Even though maybe their child brought them to the hospital. Perhaps he just goes to the house, bring them to the hospital, but they live alone. Yeah, there's a shift in that. And the shift, and it's just for the caregivers to be aware that I know elderly at that age, there could be some form of stubbornness. They might not want to yield to their, bringing someone.
Yes,
Yes, because I saw a patient and she was like, she doesn't want want anyone to stay with her. They steal her money. They do this. And I was trying to convince her that everyone cannot be bad. At least there's still that one person that can stay with you and help you with the chores and all of that. You can't, be staying alone, sleeping alone. What if there's an emergency? Who would you call on to?
Come in.
Yeah.
All right. Well said. Well said. Well, you are listening to Health Insurance Today on radio, Health Insurance Today on radio, on Lagos Traffic Radio 96.1 FM. And the voice you have been listening to as our guest is Dr. Adegbola, who is an expert in the care of the elderly. My question to you is talking about the health challenges, the health issues that affect the elderly. What are those health issues that affect our elderly here in Nigeria?
Yeah, so thank you. So we have so many of them. I'm sure we are aware of hypertension, the common ones, hypertension, diabetes, osteoarthritis, even cancer. Now, there's something we call geriatric giants. Just like now you know what geriatric means. So giants are like those diverse health conditions, that affect the elderly people. And, from visual impairments, patients, they are liable to having cataract, glaucoma, refractive errors, hearing impairment. They're at risk of infections because they have low immunity. There is risk of immobility due to osteoarthritis, stiffened joints. They are not able to move well. They have pain. They are at risk of urinary fecal incontinence.
Wow, it's a whole lot.
Yes,
it's a whole lot. If I was to keep mentioning, this program will end on that note of mentioning.
Imagine, when you say that, one takes my mind back to some of the complaints you hear these elderlies mention, and we have taken that for granted.
Yes.
Really, I must say I'm guilty of that. That when they talk about, I can't walk, I can't cross, you just assume that, that's normal.
And you tell them it's old age.
Yes.
Those are the words we use.
We said it's old age, but it's a lot of things that can be taken care of. And it's so good to hear that we have a specialist, or we have a sector of the health sector that is taking care of the elderly, and their focus is majorly on their well-being and the ability for them to manage the situation as they old and they age. All right, for those who would like to join our conversation, let me let them know you can reach out to us on 09153877127. You have an elderly and you want to know more about taking care of them and the health insurance available for them. Now, let me let you know that we have health insurance that covers for the elderly, and that's why we brought this topic of discussion. And I will let you know the number in which you can call for you to make more inquiries, to know more about the packages that we have for the elderly when it comes to insurance. And also, a new thing coming up, which I got the information that says that we're creating a WhatsApp community. That our number.
Thank you.
So the number we have will be shared for you to continue to get the information and the education needed to enlighten people when it comes to the packages available for them in the insurance sector. But more of that will be coming your way. Lagos Traffic Radio 96.1 FM.
Welcome back. This is Lagos Traffic Radio, and of course the program is Health Insurance Today on radio. We've been having a beautiful conversation with the topic on this particular beautiful topic, care of the elderly, with Dr. Abiola Adegbola, Senior Registrar, Department of Family Medicine, Lagos University Teaching Hospital. There was a word you mentioned, geriatrics.
Yes.
I can't forget that again. All right, we're still talking about questions, but we know that the phone lines will be opened very soon for you to ask all the questions that you need to or you want answers to. Let's talk about their finance, taking care of the elderly. What you just mentioned would require money.
Yeah.
And insurance, that's why we're here today. Are there barriers to access the healthcare by elderly, or is finance a part of these? You must have had some conversations with them.
Yes, there are a lot of barriers. Finance is one of them, as you've mentioned. The cost of healthcare now is on the increase. And then particularly for the elderly, because they have multi-morbidity, they have, more than one chronic conditions. So they incur a lot of, costs, for them to access good care. Then other things, that could be a barrier is even the Japa syndrome that we have now, that we have,
Oh, really?
yes, fewer doctors on ground. The elderly, when they come, usually they are old, frail. When they come, they just want to see a doctor and then they go back home. But most times they have to wait because, yes, they have to wait. And, they might not want to come back to the hospital if they have to wait. Another thing is support, even from their family. Some family members or friends might say, okay, you don't need to go to the hospital, you are old, you just sit at home. But when they complain to you, I have pain, I have this, it's just ideal for you to, tell them you have to go to the hospital. Let's not just manage it at home. So those are some of the barriers that would have for them to be able to access good quality healthcare.
All right, so leveraging on where you stop, my question goes to you this way. Would you say the healthcare system in Nigeria supports the care of the elderly like it does to the younger ones?
Yeah, I would say to an extent we are not there. We don't have the, ideal geriatric centers and all of that, but we are getting there. At least in LUTH, like I said earlier, we see quite a number of elderly patients, both on outpatient basis and even patients on ward admissions. Quite a number of them, we provide them with quality care. So
rating Nigeria government on the support of the elderly from the scale of 1 to 10, how would you rate it?
Well, let me give an average.
Okay.
But I wanted to paint a picture of what really transpires, because we know that Lagos is a model city. We can't take it away from that, because I believe other people would be watching us streaming, even if it's not now, later on. What are the basic things you do, particularly to help, ameliorate the financial issues for the elderly when they come?
Okay. So, it's good that we are talking on health insurance. So I think let me start with that. That's one aspect.
Okay.
Health insurance would at least help them. It will really go a long way, for them to reduce the costs of their health care, because these people have to buy medications, they have to do investigations year in and out. If they are on cancer treatments, they might need to go for chemotherapy, radiotherapy, and these things, they cost even to millions sometimes. So, bringing the health insurance scheme into the care of the elderly is a very important aspect. And currently, for the health insurance, we have the National Health Insurance Authority. That is the large body that governs, health insurance. And there is a scheme, we call it Group Individuals Family Social Health Insurance Program. This scheme helps, any individual. It's even for all age groups. It might not be particularly for the elderly, but of course we know the elderly will benefit so much from it. So they can just enroll for it, for this insurance scheme, and then pay an amount every year. I think it's even less than 60,000 that they get to pay, and then choose any hospital of their choice as their primary care, facility for them to access care. So it will really help, to reduce the cost of healthcare.
Okay, so let's sell insurance. Let's sell health insurance to our listener. For those how well have they been taken care of for those who are on the health insurance here in Lagos?
Yes, okay, here in Lagos, using my hospital as an example, because we see quite a number of them. A lot of the elderly, they benefit from health insurance. So they are, like I said, they have chronic conditions like hypertension, diabetes. It covers their medications. Yes, and most medications are given monthly. Even if they have to do their basic tests, it covers. However, under the scheme, we have some investigations that the scheme covers.
Okay.
It's good to know that, so that they don't say the doctor said, there are some.
They are not paying for this.
So by investigation, it means that they get consultancies and then diagnosis.
Yes.
Okay.
So the first thing when they come, they've registered under the scheme. Yes, they are able to see the doctor. After seeing the doctor might request for some investigations. They send them for the investigations.
Investigation being tests.
Yes, the tests, the scans, the blood test, the scan, the X-rays, and all of that.
Okay.
And then thereafter, they get their medications under the NHIA. The medications, usually their medications is monthly and they come back every month for us to see them again. Yes.
All right. Lagos Traffic Radio 96.1 FM. Health insurance today on radio is what you are listening to. And our guest in the studio is Dr. Adegbola, who is an expert in the care of the elderly. Now, we had those who had been calling for the past few weeks talking about, do you have package for elders? Do you have package for elders? Well, today we are letting you know authoritatively that we have package for elderly. And remember that the program is brought to you by A-Star Communications. They are the authority in this. And yes, we'll let you know that we have package for the elderly. You can actually call in and join our conversation. We have just about a few minutes to go. We'd love to know if you have questions, if you have inquiries regarding this package for the elderly, or you want to ask the doctor in the studio questions. It is fine for you to call in on the number 09153877127, 09153877127, or send a message to us on 0809-9120-777. Or for those who would want to call in at the end of the program or much more later to make inquiries, it is fine. You can call the number 090-153-88634. Again, 090-1-538-8634. That is the number for you to call. Someone will be there at the other side of the phone to pick up and answer your questions. Regina.
Okay, this question is very important. I held it right on my breast. What kind of support do you think children can give the elderly ones, especially in the area of medical care? Now, before you answer that, bear in mind the African relationships we have. Sometimes we it's overrated or underrated depending on the situation. But what would you, under these conditions that you have mentioned, what would you advise children to do when it comes to insurance for the medical care of their elders?
Okay, thank you. So, well, the children, there's so many things they can do, for their loved ones, the elderly ones. So I will start with, the financial part, which is just one of the ways they can help them. Of course, provision of funds for these elderly people. Another thing is, as at the time when due, another thing is support. They need, their support in terms of the elderly ones should not stay alone. They should stay with their loved ones. It's very important because, and again, even if they're staying alone, the children could get them some a form of caregiver to provide, the basic care for them. Because I saw a patient, the wife, she is 70, the husband is 73, and she does the running around for the man. When I got talking to her that the husband had to, go to another department, she just started crying. She said she can't do it, that she's tired. So I had to just put a call through to the
children.
Yes, to one of the children, and told her that, please, you need to get someone for your parents. Your mom can't be running around for your dad. It's really getting overwhelming. So that support is very important, and it's important for the husband, for the wives. Sometimes you feel you can't live with elderly people. They have exigencies, I think we should just be more accommodating, to have them around. This is the only time we have with them.
Okay, all right, so you can join our conversation. We still have about a few minutes to go. 080-09153-877-127. But a question is here, and this is from Olamide. And Olamide is asking, for the health insurance, do we have age limits for the elderly to be taken care of?
No, we don't. There are no age limits under the health insurance scheme. All they need to do is just to, just apply for it. Go to their office, make inquiries, apply, pay the yearly due, and they are, they give them the primary health care facility they are supposed to be going to. So there's no age limit.
Okay, a quick update. Let me quickly take this. There is a report of a broken down truck loaded with cement at Sunbird filling station in Wadalasia and turning inward Ekpe, having mechanical faults. The owner have been contacted. Mechanic is working for its evacuation. We do not have casualties recorded. It has no effects on traffic. Regina, how did we get here? It's just about 5 minutes for us to leave.
I can't imagine.
Why?
I thought you were going to say we still have some 10 minutes at least, but we thank that person that asked that very salient question. But last word from you, doctor, before we wrap it up.
Okay, so the care of the elderly is an important topic, and then it's good that we provide social support for our elderly ones, and it's also good to know that there is health insurance available for them, which would help reduce the costs of health care. As we know that the elderly ones, they have geriatric giants, they are at risk of a lot of conditions, and also it's important that when your elderly ones, when they make complaints, don't tell them it's old age. It's good to listen to them, bring them to the hospital, let's take care of them. So it's important.
Well, thank you, Dr. Abiola Adegbola.
Before you round up and say thank you, Olusegun is asking that we should repeat the contact number for inquiries after the program.
Oh, that's amazing. Thank you so much. I could call the number now.
Yes, go ahead.
0901 538 8634. Let me say it again. 0901 538 8634. You can send that. That's a WhatsApp message. And don't forget, save the number. Our WhatsApp community will soon be created so that you could go further with your questions.
And we also have our email address, which is info@healthinsurancetoday.ng. info@healthinsurancetoday.ng. You can send a mail to us for your inquiries, everything you want to know about health insurance that we are in charge of, or what the packages that we have. You can send a mail to us. Someone will respond to you promptly to get an answer for your questions.
And now to say thank you to Dr. Abiola Adegbola, a senior registrar from the Department of Family Medicine, LUTH, that's Lagos University Teaching Hospital. Thank you for sharing these useful tips on the topic care of the elderly. I think I've taken a cue. I would not do what I thought I used to do. I thought it was right. It's no longer right.
Okay, it is no longer right. And we also want to thank our listener for tuning in to Health Insurance Today on Radio, brought to you by A-Star Communications Limited. And we hope you found our discussion very informative and helpful. And if you want to reach out to us, like we said, the number again is 090-1538 8634. That's the number for you to reach out to us and contact us for questions and inquiries regarding the packages that we have for you.
And of course, don't forget to tune in next week, Friday, talking about Friday. Same time for more information and insights on health insurance. And until then, stay healthy and stay informed. I'm Regina Chris-Ogbodo.
Yes, and my name is Dayo Anthony. I know we know that many HMOs in Nigeria offer health insurance plan for the elderly. And if you would like to know or find out how you can buy such insurance plan for your elderly, the ones in any part of the country, you just want to know more about the topic of discussion today, like we said, reach out to us on those numbers, which is 0901-538-8634, or send a mail to info@healthinsurancetoday.ng, and you would get your answers to your questions. And this is about the size of the program. We hope we have delivered. Regina, Abi?
I think we did, and we're glad that our questions were asked and answers were given.
And if you still have more questions regarding health insurance, reach out to us. Next week, the program makes a return with another educative topic. Now, we're here to always educate you when it comes to health insurance and the packages available, the way you can take advantage of it for the ones that connect to you. We're always here every Friday from 4:30 till 5 p.m. to let you know what we are discussing. My name remains Dayo Anthony.
And I remain Regina Chris-Ogbodo.
Join us again next week, Friday. Till then, have an amazing time. I'm still very much here. I'm still very much here in the studio. All right, take care and God bless.